If you've been diagnosed with breast cancer, you will have several surgical options which you should evaluate with your medical team. Here with more is Dr. James Frost, breast surgeon with Premier Surgical Network in Egg Harbor Township. What are some of the most common surgical options for women with breast cancer?
When I discuss surgical options with the patient, we first decide on the decision tree between mastectomy, removing the breast, or conserving the breast. Under breast conservation, there's the partial mastectomy or lumpectomy versus the plastic surgical partial mastectomy, which we call an oncoplastic partial mastectomy, where we lift and reduce the breast and usually do a mastopexy or reduction in lift on the opposite breast for symmetry. Under mastectomy, if the woman would like her breast removed, and that could be for a number of different reasons, then we also talk about reconstruction. We also talk about whether the other breast should be removed and reconstructed for symmetry.
And then when it comes to mastectomy, you decide what type of mastectomy, how you're going to reconstruct the breast.
Exactly. And that involves consultation with the plastic surgeon before any surgery is performed.
And you have plastic surgeons in your group, so you work with them.
Exactly.
Yeah, that makes it easier for everyone.
It does. It makes it much easier on the patient. In many of our offices, the plastic surgeon will come to the same office, which makes it much easier as far as the length of time a patient has to wait and how quickly we can set up surgery for the patient.
What are the considerations when deciding what surgery is best for you?
The size of the breast tumor in comparison to the size of the patient's breast. And then basically it's patient preference as well. What do I want to look like when all this is done? On top of that, some patients can't tolerate the thought of keeping their breast if they've had breast cancer. And of course, we take that into consideration.
All right, great information. Thank you so much, Dr. James Frost of Premier Surgical Network.